If you're like me and many other Americans, the cost of basic medical care can feel like a fortune. If you've ever been into a doctor's office and asked for the cost of the examination without insurance, your jaw may have dropped to the floor like mine has. Amy LePan's article, published in the Journal of Sociology and Welfare, notes that the inability to afford health insurance plans leave many working poor with untreated conditions that leave the worker unable to perform their duties, which results in a vicious cycle of compromised work productivity. Although there is a healthcare reform currently, All About the Healthcare Reform notes that it requires individuals to pay for coverage or suffer a penalty. In addition, the cost of doctors' visits and medications are rising right along with the cost of inflation. The number of Americans out of work and families under the poverty level continues to be at a very high level. The proposed healthcare system as it stands now is not sufficient. The broad-spectrum coverage is still unaffordable to many people. Natalie Marichel's article in Media and Communication draws attention to the fact that low-income Americans must submit to invasive monitoring of their private lives in order to receive the benefits to which they are legally entitled. This consists of job applications, income statements, references from others, and many more. Amy LePan's article also mentions that a healthcare system based on preventative care, as opposed to waiting until an ailment needs expensive treatment, will ensure that the working poor Americans are not shut out of the healthcare system. The idea of a free basic healthcare program may sound like a great plan, but with every great plan comes opposition. Many opposing parties may argue that insurance companies would make less money because of an inability to selectively deny clients. Ensuring that a free medical plan would cover every person exactly the same way would make this argument invalid. As with every free service, there may be a group of people that try to abuse the system to receive more treatment or medication than necessary. Imposing a strict outline of acceptable services that each person may receive can make it clear to the patient what kind of treatment they are able to receive. There will also always be a group of citizens that refuse to see a doctor or refuse to get health insurance strictly due to cost. Providing these Americans with the tools necessary to better their health may create an increase in preventative care. Presenting the United States with a free healthcare plan for basic medical needs would solve a lot of problems with our current healthcare system. According to John Meadowcroft, most contemporary European social democracies, such as Denmark, France, Italy, and the United Kingdom, aspire to provide single-tier healthcare systems. Amy LePan also draws attention to our current net welfare reforms that cover the children of the working poor, but leave parents without coverage. After providing this type of system, successes are being found in working citizens seeking medical care under the reforms in Europe. Leaving any American without access to health care is unethical, and unequal access to medical treatments is intolerable. John Meadowcroft reviews current healthcare reforms and indicates that citizens in contemporary social democracies may end up purchasing additional coverage if they have sufficient funds. Those with pre-existing medical conditions may need to purchase this additional coverage, but basic care is not something that they will need to worry about. Shabir Syed Abdul states in his article that this type of universal healthcare has been successful in Taiwan since 1995. Think about those Americans that can't afford a yearly doctor's visit or basic medications. Explore the possibility of a national healthcare plan that provides basic healthcare for free to every American. Consider voting for a governor or other representative that is interested in a free healthcare reform, and make your opinions known. Why are you paused?